this way, and that inside that groove, so like this. Okay, so inside this radial notch of ulna. On the other hand, down here, I forgot to mention, then this is the ulnar notch of radius. Here the ulna will sort of rotate inside this notch of radius, but actually the ulna doesn't really rotate at all, only radius rotates. So radius will rotate here inside this notch, and when it does rotate, of course if the top rotates, the bottom is going to rotate. So when the top rotates, the bottom portion, like this, look at my finger, how I'm pointing, this is that base of radius, it's going to come like that. Okay, so like that towards you, and that is what allows us to take our hand and do this. Okay, so that the radius here rotates inside the radial notch of ulna, and the base of radius goes on top of the ulna using via this notch here, which is the ulnar notch of radius. Okay, and finally the ulna. Okay, we look here, there is a tuberosity as well, ulnar tuberosity, site of attachment of brachialis muscle, and the rest nothing much but a bone, except here a protrusion that is called the styloid process of ulna. Styloid process of radius, styloid process of ulna. Okay, there it is on my hand. There's a bump right here. See that bump? That's the styloid process of ulna over there. And finally, the ulna doesn't reach the wrist. Radius does. The ulna is a little too short, so there's a cartilage here, kind of like, you know, to fill up that space, because ulna is shorter than the radius, so it doesn't reach all the way because the wrist starts here. Before we go on to the hands, I would like to mention one more thing. And we looked at the ulna anterior view. However, the back of ulna, so here's the coronoid process of ulna, the back has a structure called the olecranon, which goes up. Okay, and this forms your elbow, the olecranon, like that. So if you look at this is the front view. If you look at it from the side view here, so this picture here shows it, this view, looking at it from here, and that sticks up the olecranon is here. Okay, so there's the coronoid process. This is supposed to be the trochlea and the humerus. Coronoid process only here, and then the styloid, the tuberosity of ulnar tuberosity is here. There's the olecranon, and as you can see, because of the olecranon, you cannot take the ulna and extend it more back, because if you so this would be when you flex your arm, would look like that. So that's when your arm is flexed, and then when you straighten your arm, the back of the arm, the olecranon, which I can't show you because, but when you straighten your arm, the olecranon then comes in contact here. Okay, so now we will look at the hand, the bones of the hand. As you can see, the hand is this consists of a structure, a collection of bones here called the carpal bones. So this carpal bones here would be like, if you look at my hand, is just the very beginning of my wrist, not halfway into my palm, just the very beginning of my wrist. So for example, in this drawing, you can see where the thumb starts, you already should be like halfway into the carpal bones. So it's just at the beginning of the wrist, not the palm, just the wrist area. Okay, so here, and it consists of 8 bones, 4 proximal and 4 distal. Distal means farther away. Okay, so the 4 proximal and 4 distal, so altogether forming the carpal bones. Then you have 5 metacarpal bones. So carpal, metacarpal. We numbered them so that the thumb is number 1 and pinky is 5. So the first metacarpal is the metacarpal of the thumb, and the 5th metacarpal is the metacarpal of the pinky. By pinky I mean this one. Okay, so 1, 2, 3, 4, 5, and likewise same thing we do for the digits. Thumb is the first, then index finger second, middle finger third, and then fourth, and then pinky is 5th.